So, hello, my name is Devonna. I'm going to be your student nurse today. I'm going to be doing a full assessment on you from head to toe. Is that okay? Yes. With that being said, would you like for the curtains to be closed to give you your privacy due to HIPAA? Yes, okay. So I'm gonna close the curtains to give the patient their privacy and also to respect their rights with privacy. I put hand sanitizer on my hands. I'm putting gloves on. Before we get started, I need you to verify your first and your last name. So patient verifies first and last name, which is George Templeton. Date of birth is 5/30/76. All right, Mr. Templeton, I hope that's okay for me to call you that. Before we get started, do you need to use the restroom, or do you need any needs that needs to be met? The patient says no. So I said, okay, perfect. So with that being said, as I'm lifting up the bed, I ask the patient, do he know what today's date is? He says, yes, it's Tuesday, November 22nd, 2022. I ask, who's the president? He says, Joe Biden. Then I ask, why is he here? And he says, yes, because he hit his head. All right. So before we get started, before I touch you with anything, can you tell me, do you have any allergies to anything? The patient says, no, no allergies to anything. And do you have any family history with any medical issues such as hyperthyroidism, seizures? Do you have any issues with cardiovascular disease, anything in that nature, or skin problems? He said, no. So I said, okay, perfect. All right. I'm just gonna lift you up a little bit more to my height so I don't break my back. All right, so Mr. Templeton, first thing I'm gonna be doing is your head assessment. But before I touch you, let me re-sanitize and change my gloves. I was gonna include that in my assessment.
Oh, you were?
It's fine.
Oh.
It was on there before I came. Right, so the first thing I'm gonna be doing is checking the patient's scalp. I'm checking to see if there's like any pus, if there's any like lesions, anything abnormal on the scalp. So the first thing I do is I'm checking the scalp. I did make sure the bed is locked too, by the way.
I saw you do that.
So I'm checking to see if there's any lesions on the head. I'm checking underneath the neck as well. I'm checking behind the ears. Let's see, I'm checking around the neck. The patient said that they did not have any history with seizures or hyperthyroidism. So I'm also checking the midline, the trachea to make sure it's midline, make sure nothing is deviated. I'm checking the JVDC to make sure there's like no distension going on. I'm asking the patient to swallow to check for the thyroid because he said that there's no history of hyperthyroidism. So when he swallowed, I felt it went back perfectly. I'm checking lymph nodes behind the ears, in front of the ears, which all seems normal. I'm asking the patient to smile for me because at this point I'm gonna be checking cranial nerves, so the patient is able to smile. Can you make a fish face, like blow out your cheeks? They did that perfectly. I'm also checking the eyes to make sure I don't see anything abnormal. I'm gonna grab the patient's eyes and I'm gonna ask you, Mr. Templeton, to close your eyes and keep them closed. And what I'm gonna do is try to open them, but I want you to resist me. So the patient is able to resist me from opening up their eyes, which is perfect. I'm also checking like the frontal and the maxillary sinus. Do you feel any pain or any pressure, anything like that? The patient says no. With that being said, I'm gonna grab my flashlight. I'm checking the nostril. Checking the patient nostrils. The nostril is nice and pink. The mucosal layer is moisturized, so it's not dry in there. While the patient has their mouth open, I'm also checking for like teeth, which seems perfect. I'm checking the mucosal layer, which seems moisturized, is nice and pink. I don't see any like cuts or opens or anything abnormal there. I ask the patient to stick out their tongue. There's nothing abnormal. The patient is able to stick out the tongue. There's no shakiness or anything like that. The patient eyes is open. Again, the patient said that they have no seizures. So I'm checking like the sclera of the patient. I'm also going to be checking like perla and accommodation. So I'm going to flash the light in one eye, but I'm checking the other eye to see if it also constricts. It does. And do the other eye. It does. That's perfect. Mr. Templeton, I'm going to ask you to follow my pen light. So I'm going to go out, close, and then I'm going to just do some different designs I want you to follow. So I'm going back, I'm going in, I'm going a little bit back so I'm not too close to his face. I'm going up, down, side to side as if I'm making a cross, diagonal, and then another diagonal. Perfect. The patient is able to follow my pen light in all directions. I'm also checking the ears to see if there's any like drainage out of that ear. Can you turn your head my direction, please? There's no drainage in that ear as well. I'm gonna whisper in your ear 3 words, and I just want you to repeat after me. 1, 2, 3. The patient is able to repeat 1, 2, 3. The patient is able to repeat ABC. All right. With that being said, let's see. I make sure the JVD. All right. So the patient was able to smile, make poker fish face, and one last thing, can you make a sad face? All right, and the patient is able to make a sad face. So I'm done with the cranial, the head assessment. Now I'm gonna move down. With me moving down, I'm gonna take my stethoscope and I'm taking some alcohol wipes, and what I'm gonna do is clean my stethoscope before I place it on the patient, if I don't drop my alcohol wipe. So I'm taking my stethoscope, I'm cleaning it. All right, and so Mr. Templeton, what I'm gonna do is I'm gonna be checking your carotid sounds, and then I'll be checking your heart, your lung sounds, and then your heart sounds, okay? So I'm using the bill side of my stethoscope. The patient is gonna turn his head to the right. I'm gonna ask the patient to hold their breath while I check the carotid sounds. All right, breathe, all right, and then turn your head my direction, please. And I'm gonna ask the patient to stop breathing while I check the carotid sound. Perfect. While I'm here, I'm just making sure I'm double checking the lymph nodes just to make sure I did it. All right, so that's perfect. I don't know why I took that off. And then next thing I'm gonna do is check your respiratory sounds. As I'm checking the respiratory sounds, the lung sounds, I'm also looking at the chest to make sure it's in sync. I'm also checking the skin to see if there's any like lesions or any abrasions like on the arms, anything abnormal. So the first thing I'm gonna do is above the clavicle on the left side, checking for lung sounds, and I'm using the diaphragm side of my stethoscope. All right. All right. Everything sounds normal. All right, and then now I'm checking the heart sounds. I'm using the diaphragm side of my stethoscope. I'm going underneath the clavicle, 2 spaces, intercostal space, and I'm checking the aortic sounds. Then I'm checking the pulmonary semilunar sounds. Then I'm gonna change my stethoscope to the bell sign, and I'm checking Ear's point. All right, and then next I'm gonna go back to the diaphragm side, and I'm checking the tricuspid sound. And then next I'm checking the mitral sound or the bicuspid sound. All right, it sounds normal. And then I'm gonna be listening to the mitral sounds and the radio pulse for 1 minute, just to make sure it's in sync. It is. All right, and then I'm gonna be checking the radio pulses on both sides to make sure they are in sync. Perfect. So I'm just gonna cover your chest, but I'm gonna leave your stomach exposed. Actually, I'll just leave you covered for right now to keep you nice and warm. I'm checking the arms to see if the patient has any like lesions or anything like that. On the left arm, the patient do have a lesion, so I will make sure I document that. I will ask the patient how they got it. They will explain it. But while I'm here at the fingers, I'm checking for a capillary refill. It's normal. It goes back about 2 seconds. I ask the patient to spread their fingers apart, and as they are abducting their fingers, what I'm going to do is adduct their fingers, and what they're going to do is resist. So patient is able to do that. I'm checking for symmetry in arms, make sure patient can move arms up, okay, down. And there's no other lesions or anything like that I see on the patient. I see. And then I ask the patient to resist me pulling them. So I'm gonna pull them, and then what they're gonna do is resist. So patient is able to resist, and then as I hold the patient hands, I'm gonna ask them to push me away from them as I push towards them. So they're able to do that as well. So there's no concerns there. So next, Mr. Templeton, I'm gonna look at your abdominal region, just to make sure there's not any abnormalities. Make sure it's like contour, it's flat. I don't see any pulsations. So I'm inspecting first before I do anything. And then next thing I'm gonna do is gonna listen. So I'm gonna listen to all 4 quadrants before I put my stethoscope on the patient. Once again, I'm gonna clean my stethoscope. Make sure it's all clean. And then I'm gonna listen to all 4 vowel sounds. So all 4 vowel sounds, I should hear something within a minute. But if I don't, then I will listen to each quadrant for 5 minutes. So 1, 2, 3, 4. And then I'm gonna palpate the patient very gently, nothing like rough. I'm gonna palpate to make sure there's no pain. I'm asking the patient, do they feel any pain? Do you feel any pain? Mr. Templeton says no. So everything is normal there. Let's see what's the turn this. Okay, so that is normal. And so then I'm gonna come down to the legs. I'm just gonna bring this back. All right, so while I'm going down to the legs, and then as I'm putting the covers back, I'm still checking for anything abnormal in the skin, such as lesions again, any abrasions, any bruising, anything sort of that nature. I'm gonna take this off for a second. I'm also checking for capillary refill on the toes.
Just leave it off.
I'll just leave it off?
Yeah, we don't need, wasn't part of it. There we go.
Okay. I'm checking for capillary refill. It's normal. The patient capillary refill is able to go back in 2 seconds. I'm also going to check the pedal pulse. That is perfectly in normal range as well. I can feel it. Let's see. I'm asked the patient to point their toes, so like plantar position. And while they do that, I'm going to basically go against them, so they are able to fight the urge of me trying to flex their feet backwards to dorsiflex. And then they're gonna do the opposite. They're gonna dorsiflex and point the toes backwards while I try to point it forward, and then they're able to resist my pressure. So perfect job. I'm gonna lift this knee up so it's like range of motion. And also I'm checking underneath the legs also to make sure nothing abnormal on the skin again. And same thing with the left leg. Okay. One thing I think I forgot.
You can always go back.
Is I'm also checking the sclera to make sure it's like yellow, not yellow, oh Jesus. Make sure it's white and it's clear. So I don't see anything abnormal in the sclera. All right, so with that being said, are you able to sit up a little bit? The patient says yes. So what I'm gonna do is sit the patient up, and then I'm gonna ask the patient to dangle their feet down. They're gonna wait at least for a minute, just to make sure they're not dizzy or anything like that. I'm gonna get you down. So while the patient is down, the patient's gonna be standing up right in front of me, and what I'm gonna be doing is I'm gonna be checking the patient's spine. I'm checking to make sure like the spine is not abnormal, such as like any scoliosis, kyphosis, or lordosis. So the patient's spine is in normal range. It's very, it's normal. And then with that being said, I'm gonna take my stethoscope. Again, I'm gonna take off my gloves. I'm gonna sanitize my hands. I'm gonna sanitize my hands, put on my gloves, bring in my stethoscope. My hands are getting fat. Sweat. Yeah. Okay. Cleaning the stethoscope. Maybe if you get something, but we'll go back to that in a second. All right, so now I'm checking the back of the patient. I'm gonna ask the patient to breathe in and out. I'm making sure I'm off the scapula. I'm using my diaphragm. So ask the patient to breathe in, breathe out, 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 breathe in, breathe out. One more time. Breathe in, breathe out, breathe in, breathe out. And so then respiratory sounds perfectly fine. I'm also going to make sure the kidneys are intact, and I'm going to explain to the patient if they feel any pain, so please let me know. So my hand is over the right kidney, and then I'm tapping. Do that hurt, Mr. Templeton? He says no. And do the other side, tap. Do that hurt? And he says no, it doesn't hurt. So perfect. So then I ask the patient to face me. And I might have to change my gloves again after I do this. So I'm gonna change my gloves. I'm gonna hand sanitize. And with that being said, I'm gonna ask you to stick out your tongue one more time. And then what I'm doing is I'm checking like your gag reflex, okay? So the patient sticks out their tongue. I'm checking for the gag reflex. Says the uvula is midline. It's not deviated off or anything like that. He has a nice gag reflex, so everything is perfect there. Okay, so now that the patient is facing me, I'm gonna ask the patient to gait. So I'm checking for the patient's gait, make sure they are balanced as they are walking forward and as they're walking back. Perfect. And we're just going to be checking some range of motion, okay? Just want to make sure you're able to do some things. I know you're able to bend your knees, but I want to make sure your upper body has some strength as well. So I'm going to put my hand on your shoulders, and I just want you to just go against me. So as I'm pressing down, I want you to elevate your shoulders up. So the patient is able to do that. I'm going to ask the patient to stick the arms out and up, and then like just pull downwards. All right, and the patient is able to do that. Now just relax your arms, and then let's just look at your neck, your range of neck motion. So we're gonna look up, we're gonna look down, we're gonna look right, we're gonna look left, we're gonna put ear to our right shoulder, ear to our left shoulder. All right, how do you feel? The patient says he feels awesome. He actually needed it. And then we're gonna raise our hands up, and then we're gonna try to like reach to our toes without falling down. So as you do that, I'm gonna watch this, just make sure you're not tipping over. So the patient's gonna bend down just like this. So the patient does it, he's fine. The patient is able to stick out their leg. Can you stick out your right leg in circular motion while the left foot stays planted on the foot? The patient is able to do that. Now we're gonna do the other leg. The patient is able to do that. So the patient has a good range of motion between the arms, the legs, and able to bend. So then at this point, I'm gonna ask the patient to have a seat. As the patient sit down, I'm gonna make sure the patient needs anything, such as a cup of water or anything. The patient says no. I make sure the patient has their call light button, so please give me a call if you need anything. Myself or aide will be in to assist you with anything you need. Before we go, or before I go, do you need to use the restroom? The patient says no. So then I put the patient back in the bed, make sure the patient is comfortable. I make sure the room is safe by one, picking up this wipe that I dropped off on the floor and cleaning off my area. And Mr. Templeton, before I leave, again, do you have any questions or concerns about your assessment? He says no, and I told him I'll see him shortly. All right, and as I leave, I'll take off my gloves. I hand sanitize my stethoscope, hand sanitize my hands. Once again, just cleaning up my mess, and then I exit out the room.
Okay, couple things. When you're looking at the face, what might you want to look at?
I didn't do the mastication to tighten up the jaw, did I?
Go ahead.
Okay,
Show me how to do it.
so I'm gonna put back on my gloves. I get hand sanitize. Mr. Templeton, can you bite down on your teeth? Let's put this on. My hands are so wet. Okay. So the patient is able to bite down. So can you move your jawline back and forth? The patient is able to move the jaw back and forth, is able to bite down and clench.
Okay.
See, is there anything?
How about the nose?
Oh, I did check the inside, but can you hold down your nostril and breathe in? All right, and then hold down your other nostril and breathe in. Deep breath. Okay, perfect.
And if you wanted to know if they could see okay.
That's right, I did the scissors. And then one last question. Are you able to read my shirt? Mr. Timber says yes. It says PLU School of Nursing. That's right, Mr. Timber. Thank you.
Okay, arms and legs. There's one thing you forgot that we do on both of them.
So I check symmetry. I check capillary refill, lesions. I did the resistance, range of motion. He did the bending, did the radial pulse.
Okay. So sensation on both of those.
Oh, I knew that.
Okay, that's okay. It's a lot. It's a lot to remember. Was there anything? Oh, the face. So back to the face. Let me tell you what you looked at. You looked at closing the eyes tight, big smile, and puffing out cheeks. What's the first thing you want to look at when you look at them? The first thing you do.
What is the first thing I want to do when looking at a patient?
At the face.
At
Or
the
any
face.
part of the body, actually.
I guess. Well, I checked to see if there was any abnormalities in the skin. Oh, I didn't say that.
And?
Oh, and was it any like what's the word I'm looking for? Like what's the word?
Gotcha.
Is there still
Asymmetry.
symmetry?
Asymmetry.
Make sure there's symmetry in the face.
Alrighty.
Sorry, I didn't say that, huh?
You didn't. And
Yes.
Okay. I think you did a great job. It's up to you if you want to do it again, and you can turn your phone off if you want. I think you, look at the score. I gave you points for all those that you're able to